I Ubered home from the emergency room after getting discharged from being comatose from alcohol poisoning.
Oh, my goodness.
And I laid in bed for about 24 straight hours without eating, without moving, just in the darkness, contemplating what to do. And on January 2nd, 2021, I decided I'm going to have to kill myself because there's no way that I can move forward from here. And on January 3rd, 2021, I walked into the doors of Enterhealth.
With this podcast, what we're trying to do is have real, authentic discourse.
Savannah, it's good to have you here this morning.
I'm so excited to be here. Thank you so much for having me.
Absolutely. I've been looking forward to doing this. So, as you know, this is our podcast that we started this year. It's called Treatment Redefined. And our objective is to really try to facilitate a lot of good, honest, authentic discussion around addiction and mental health. Mm-hmm. And so we've had a variety of thought leaders that have come on over the last few months, and I was really, really excited to know that you were going to come join me today.
Yes, I can't wait for the conversation that we're going to get into.
Yeah, me too. So I thought what we might do is just open it up and just give people a little bit of a feel for who you are. Now, I'm going to preface that with you did do treatment with Enterhealth, and now you are also a therapist providing help for people. And so I thought maybe we just kind of open it up with just a little bit of a background, like kind of where'd you grow up and where are you from?
Yeah, exactly. Well, I grew up here in Dallas. I went to Highland Park kindergarten through 12th grade. My parents still live in that area. Mm-hmm. And then I went off to college out of state. I wanted the big SEC college experience. So I went over to University of Arkansas, where my older sister went. And at that point in time, I knew I wanted to become a therapist. So I came back to Texas to go to graduate school at TCU in Fort Worth.
Yep.
And during that time, throughout college and graduate school, my drinking and substance use was ramping up. Mm-hmm. But I was still able to get what I needed to done academically. Mm-hmm. So I felt like there wasn't a problem there because that wasn't being reflected in my schooling.
Right.
And my parents had mentioned concerns over the years, even starting in high school, about my drinking and partying and just general behavior. But I felt as though as long as I was able to maintain my academics, my job, then I was A-okay.
Yeah. Did you feel like so you went off to Arkansas, and that's when you felt like, okay, you were recognizing it maybe in yourself. These issues are getting to be a little bit much. Now, when you look back on it, did you see some of those earlier signs in high school for yourself? Like, did you feel like that was really the genesis of it is in those high school years?
Absolutely. Looking back now, I can see that all the red flags were there, where I sought out alcohol, even if it meant stealing it or sneaking it. And I had many encounters with the police and school administrators, just getting in trouble a lot by anyone I really encountered in terms of adults. Yep. I was pretty rebellious, but I felt like I'm just a rebellious teenager. This isn't a problem. My parents are just super strict, and it's dumb that they don't let me drink and party.
Right. I understand.
And so when I went off to college, I felt like, see, this is what I was trying to do in high school, but my parents wouldn't let me.
Right. Okay, so just take us through this process, because I think, having known you, and you and I have gotten to know each other over these last few years, and I want to kind of just take people through this journey, because I think a lot of people are going to probably attach to this, because I think there's a lot of kids, I call them kids because they're a lot younger than me, that in high school dabble in things. They drink maybe too much, but even some of the parents are a little bit dismissive of it to an extent of, well, I used to do it when I was in high school as well. And then it gets to college, and I feel like now they've got a lot of autonomy. And sometimes those problems can start to get out of hand. At what point did you realize, okay, I've got a challenge? And then what led you to treatment? I'm trying to kind of roll through that. How did that process evolve? Like, how did you get to the point where you realized okay, this isn't something I'm going to be able to stop on my own. I'm going to need some external help. And how did you get to that point? How did you get to treatment?
Yeah, and that's a good question because for many years I was in complete denial. And my goal with a lot of my drinking and partying was to prove that I was capable of doing that while maintaining my life.
Right.
And so it wasn't until I was in my early 20s and started experiencing severe consequences to my behavior that I really became aware of the fact that I had a drinking problem. And I really did not attach to the label of an alcoholic because I wasn't drinking daily. In fact, I was only drinking once or twice a week. But when I was drinking, I was binge drinking, blacking out, and oftentimes going unconscious. And the further I got into my 20s, the worse that got. And my tolerance started to decrease. So I would have maybe 3 or 4 drinks, end up blacking out, and then going unconscious. And it was an incredibly dangerous lifestyle that I was living because I was oftentimes face down in the middle of Deep Ellum, passed out, or in a parking lot, passed out on the ground. Strangers would find me and identify my body, basically. And there was police involvement throughout that time. And fortunately, I was never arrested somehow. But as things continued to escalate, I found myself one night out on New Year's Eve of December 31st, 2020, at a New Year's Eve event at a hotel downtown Dallas, and I passed out at that party. And because my friends, or quote unquote friends, party friends, ditched my body, basically, the hotel staff found me and thought that I was having an acute overdose and called 911. Paramedics came and took me away, and my point BAC ended up being 0.36. So I was comatose and hospitalized.
Oh my goodness. It's terrifying. I mean, being a father, I've got 3 kids, as you know, and I've got 2 daughters that are in their early 20s, and it's as a parent, that would be terrifying. Tell me what was going on in the family at this point? Were they recognizing that it had gotten this severe?
That's a great question. My family knew that I had a severe drinking problem, but because I'm so headstrong and stubborn, I told them basically that I was going to continue doing what I wanted, and I was fully capable of maintaining this lifestyle despite many pieces of evidence showing that I couldn't. And it actually got to the point while I was in graduate school that my dad and stepmom made the decision to call me one day and say, hey, you know what, Savannah, we really care about you, but we can't keep living in fear. We can't keep getting calls in the middle of the night from the police or from you that you're in danger. And we're ending it here. And after this call, we're blocking your number and we will not be speaking to you.
Oh, wow.
And if you decide at some point in time that you want to get help and stop drinking, you can reach out to us. But until then, you'll have no part in this family. And so for over a year of my early 20s, I was outcasted from my family, exiled from my family. And that meant no Thanksgivings, no Christmas, no birthday wishes. And I lived in complete isolation, continuing to drink and derail my life, despite everything pointing to the fact that I needed to get sober.
Oh, my goodness. So that you went through a very long period of time then, being really separated from the family, continuing the drinking up to the point where you got treatment.
Yes. And in total, it was a decade of substance abuse that led to the point that I went into a coma. And when I woke up from a coma on January 1st, 2021, in the hospital by myself, I was so ashamed and so helpless because by that point I had lost any friend that I could reach out to for help. My parents weren't talking to me. So I actually, and this is one of the saddest things I think I've ever experienced, I Ubered home from the emergency room after getting discharged from being comatose from alcohol poisoning.
Oh, my goodness.
And I went home to my apartment where I lived by myself with just my Pomeranian. And I laid in bed for about 24 straight hours without eating, without moving, just in the darkness, contemplating what to do. And on January 2nd, 2021, I decided I'm going to have to kill myself because there's no way that I can move forward from here. I've finished grad school. I'm supposed to be working this career in mental health, but I can't get my own life together. My friends don't like me. My family doesn't like me. I felt like I had no one and nothing. And by the grace of God, I gathered the courage to call my parents who had just pulled up to their ranch in the San Antonio area. And I begged and pleaded for help. And they immediately turned around and drove straight to my apartment to make sure that they could help me. And on January 3rd, 2021, I walked into the doors of Enterhealth.
That's amazing. That's amazing story. Actually, a little bit emotional about it. So you go straight into treatment. Never been to treatment before, right?
I had never been to treatment before. I had spent my lifetime in therapy just due to my own mental health challenges, but I had resisted going to treatment even though I'm certain that my parents would have paid for it and would have loved for me to go at many different stages in my life. But this was my first time being in residential treatment, and I can truly say that when my parents came and picked me up from my apartment and told me I was going to Enterhealth, it was the first time in probably that 10-year period of substance abuse where I felt a moment of relief. And I think that's different than a lot of people going to rehab. They might feel anxiety, stress, or oppositionality. And for the first time, I felt some sense of relief that maybe, just maybe, I can have a life where I don't have to die from this disease or kill myself.
Yep. It's remarkable. You know, as you know, because you're now in the therapy space, which we'll talk about here in a minute, but often it's family that brings people to treatment. You know, it's hard for sometimes the person that I feel like is in the fire to really realize completely exactly what they need to do. But you realized in that dark moment when you called your parents that, listen, I need some help. And they rose to the occasion and they got you the help.
It was remarkable. Truly the best decision that my family's ever made was to block me. And the next best decision that they ever made was to take me to Enterhealth, because what blocking my number did and removing me from the family for that time period did was push me to the catalyst that I needed to be able to show myself that I needed treatment. And that's why when I walked through the doors of Enterhealth, I was sober and ready to go. I went to groups starting the next morning, and I spent every day at Enterhealth working to build a life that I could be proud of, a life that was worth living.
You know, it's not always that way. You know, you came into it really wanting it.
Yes.
And we talk about this from time to time, and I think about it often over the last 18 years is, you know, do you have, when you come into treatment, the day you arrive, do you have to fully want it? And I've kind of ended up getting to the conclusion that at some point you need to want it. Not often when you arrive do you fully want it. Sometimes it's external situations that have gotten you there. But at some point, I'm kind of curious on your opinion on this, would you agree that you have to lean into this? I mean, that old saying, you can lead a horse to water, but you can't make it drink. You have to engage in this and want to have some change for change to actually take place. Would you agree?
100%. A lot of people don't walk through the doors of rehab like me, gung-ho and ready to go. But during treatment, someone has to start to buy into the process in some form or fashion, and they have to have internal motivation.
Yep.
Because what I found personally and professionally is that people can have all the external motivators in the world. You know, they can be on probation, parole, have their kids taken by CPS. They can have no family contact, no money, no ability to get around because they don't have a license. You know, they can have all the external motivators in the world to get better and get sober. But if you don't have that internal motivation, more likely than not, you'll turn back to drugs and alcohol.
I think you're right. Well, let's go through treatment. I think sometimes it's a mystery to people, particularly folks that have never been through it. And from your perspective, what was that little journey like? Where there had to have been some ups and downs. There had to have been some challenges in the therapy room, what I call those four walls, where you're really getting to know yourself better and issues in your life and your family. But what was that like for you? And in your mind, what were the key ingredients that really help create the sustainable change that you have?
I think from the moment I walked into Enterhealth, I was treated as a respectable human. And for many years, I wasn't treated that way. I was treated as this subhuman individual because of my behaviors. And just walking in and being treated with care and dignity and respect really helped me buy into the process and know that I was at the right place. And I think some of the amenities just right off the bat were really helpful with getting adjusted, like having my own cabin and feeling comfortable, you know, getting my stuff, getting acclimated in that space. And I just felt like it was a very homey environment. The cabins, the different facilities that we would go to groups in and therapy in and eat lunch and dinner in, everything felt very comfortable to me. It didn't feel like I was in a medical treatment center or that I was in a hosptal.
Right.
And so being out in nature was really wonderful.
Yeah. It's interesting you bring it up. And to be quite honest, I think we took a lot of arrows in the back in the early days just because when we were trying to design really the environment of Enterhealth, it truly was to try to be a healing place. Let it be a healing sanctuary. And being able to be, I think, out in nature to some extent, right? We're in Texas, but actually Texas is quite beautiful. I'm a native Texan. I like the rolling hills. We're on one of the highest points of Grayson County. I think it's quite serene and tranquil. But I think the environment is really important in the healing process. And when it comes to doing this type of hard work, because we're going to get into, like, I think some of the bits and bytes here, but the work is hard. Therapy is hard. Working through issues on yourself is difficult. And to me, it's like, well, what aspects in the environment can you really provide some support to keep their dignity intact? One is, I think, just the accommodations, where they're staying. I don't know that you have to have 2 and 3 and 4 people in a room together. Now, we were told in the early days that you have to do it that way. But I'm not a believer in that as long as you have a real structured program. But I think if you can have good accommodations that are comfortable, allow people to keep their dignity intact, the culinary part's really, really important because it all supports the really hard work that you're doing. And to me, the rubber meets the road with the therapy. Your one-on-one therapist, your group. I'm kind of curious as you go through this, what was the individual therapy like? What was that experience like for you? Was it enlightening? Was it eye-opening? Was it challenging?
I found that the therapy was so crucial to treatment because we were able to meet with our therapist 3, sometimes 4 times a week. I'd never met with a therapist that often in my life. And so being able to talk through not only day-to-day challenges, but also process things on a larger scale with my therapist was huge. And something that I was incredibly impressed by was how frequently I was able to meet with a psychiatrist. because something that often occurs in residential treatment are medication changes. And to be so closely monitored during those medication changes made me feel safe and comfortable and confident to do so, because I knew that I was working with a top-notch professional who really had my best intentions. He spent his time talking to me. He wasn't rushing off to go to his side job or, splitting his time between multiple places. He was at Enterhealth every single day, very, very focused on client care. And to me, that showed just the level of quality of care that Enterhealth provides.
I've over time, I've often wondered, and there's different ways to do this. I feel like treatment space in general, there's a lot of players involved, residential, outpatient. But I think you've got to have some really important ingredients to make the treatment work. You've got to have some great therapists, well-trained. We're going to get into that with kind of what you're doing now. But I'm a big believer, master's level trained, PhD level trained, understanding both mental health and addiction together, trauma, family systems issues. These are vital to be a really good therapist. But you got to pair it with good medical professionals too, because that co-occurring issue, which is there's a spectrum, right? But everyone that comes into treatment is dealing with some underlying emotional issue. And the medical professionals, if they give you the time to be able to get the right diagnosis, let's say, and then the right treatment on board, it can make a huge difference in your overall outcome. So I think pairing those two together is very, very important.
Right. And during this period of sobriety, of getting to understand what my own baseline was really important, because over the 10 plus years I had been in therapy, I had received at least a dozen different diagnoses. And because it was skewed by my drinking and drug use, I didn't really know what my diagnosis was. And it was the first time in my life where I was completely sober for a sustained period of time, where we could see, do I have this diagnosis or not? Yeah,
that's you bring up an interesting point that let's dive into it a little bit, which is when you think of where you can go to get treatment, you can go to outpatient, you can go to residential. And a lot of people can go to outpatient and be just fine if they catch it early, right? But there is a great value in the role of residential treatment, in that kind of what you just hit on. It allows you to get a baseline on so many things, because often in an outpatient level of care, say IOPs, PHPs, where the patient isn't necessarily ready for that level of care, they're often using throughout, and it's very difficult to get an accurate diagnosis and understand how to get the treatment sustained, because they're using through the treatment process. And so I've always loved, and that's where we began, was with residential treatment, because it allows you to really have concentrated time of a multitude of professionals that come together to where you can do a variety of diagnostics, and with the aim being, let's nail what the real underlying problems are. And you're in a safe environment, so use isn't impacting this. Then let's build a treatment plan moving forward. But I feel like in today's treatment field right now, kind of the model du jour for inpatient, and I think a lot of it's driven by reimbursement, unfortunately. I want to get your opinion on this, is that you're trying to stabilize a lot of these patients, detox, stabilization, then get them to the lowest level of care as absolutely quickly as possible. And I was talking about this with some folks earlier this week, and that this is a major problem. Actually, we were presenting to the American Bar Association on this topic, is that until that standard of care with insurance reimbursement gets on par with what's needed truly to help patients get better from addiction issues, we're going to continue to have this revolving door of problems, because you're putting patients in the wrong level of care when they need to be, probably in a sustained period of time of treatment. It may cost more for an acute episode, but it's going to pale in comparison to all of these other chronic episodes of the revolving door of outpatient.
Absolutely. And I talk to families about this all the time. And in my personal life, with families I know who are struggling with a family member who has addiction, or with my clients, is that, yes, it's going to be a major investment up front, but why allow your family member to continue suffering for years and years, in my case, for a decade, by not going to the highest level of care and addressing the problem in the most comprehensive way?
Right. You know, I'm curious on this. Do you feel like, having been through treatment and your philosophy now as you're a practitioner, do you feel like relapses, lapses, however you want to look at it, are part of the recovery process? Are they inevitable? Or is that the wrong way to look at that part of the recovery journey?
My personal philosophy is that relapse absolutely does not have to be part of the recovery cycle. There are going to be ups and downs in recovery. There's going to be hard chapters. There's going to be great chapters. But that is life.
Yep.
And we don't have to instill this idea in individuals that relapse is just part of it and expect it to happen.
Yep.
I think that's a futile way of treating individuals, and it sets them up for failure when you tell them from day one, right out the gates, that relapse is part of the cycle of recovery, because it certainly doesn't have to be. That's not part of my story, and I know that's not part of many people's stories.
Right.
And that's one really important aspect of Enterhealth that I valued, is that emphasis on us being in the driver's seat, and being in control of our recovery. It is in our control. It's a daily, sometimes hourly, sometimes minute-by-minute decision to stay sober.
Yep.
And we are the ones that get to control that. And through the smart recovery tools that we utilized at Enterhealth, I learned tangible ways of managing cravings and urgings or maladaptive behaviors, so that in those moments where maybe I was struggling, I could use those tools and not end up making a decision that would derail my recovery.
Right. You know, when you think about the different modalities of treatment, when we first came into the field, and I still think to a large extent it's this way today, it's just less, it's a little less, but the predominant way that treatment has been conducted for years is really to bring people into a treatment setting, and you really work the steps. You are going to work your way through the 12 steps and then get out and get into a support and recovery group and continue on. And I've read, I'm not in recovery, but I've read through the book, read through the big book. I think there's a lot of wonderful aspects to it. A lot of it has a religious, real spiritual tonality to it, but even its origins are more religious based. And the thing when we came and opened up Enterhealth, the thought was that these issues are so much more complex, and working the steps, to me, it's great support. It's really good for accountability, potentially. But I don't know that it should be, well, I do know, I don't think it should be the central focus and treatment modality and treatment today. You've got to get into, you're missing some really, really important pieces of the puzzle if that's all that you focus on. So I'm kind of curious, in your opinion, being a therapist now, having a lot of experience, having been through treatment, entering a place where our focus was going to be much more therapy-driven, much more, have a lot strong medical model, bringing other types of treatments to play that you might not have at other types of centers, and not really having a heavy emphasis on 12 steps, but recognizing that it's maybe an important part of your ongoing journey. What was that like?
Well, growing up in a household where my dad and stepmom are both physicians, I align with the medical model of addiction and of mental health disorders. And I felt like that Enterhealth was the perfect fit for me, truly, because I do not think that I would have been successful at a program that was really focused on 12-step. I needed that medical model, that comprehensive approach, that collaborative approach where it's multidisciplinary.
Yep.
And, I've been a client in every level of care, and I've now been a therapist in every level of care. And what I've found is that every individual who struggles with addiction and mental health disorders needs a formula of what's going to work for them, and that there's not going to be a one-size-fits-all approach for anyone.
That's right.
It's going to be a combination of things that help them maintain long-term recovery.
Yep.
And for some people, that might be therapy, psychiatry, yoga, and going on walks outdoors.
Yep.
For other people, it might be therapy, AA, having a sponsor, and playing with their dog. You know,
Right.
the formula is going to look different for everyone. And what I want us as a treatment community to break out of is this oversimplification of treatment that
Agreed.
all we need is to work the 12 steps. And if you don't work the 12 steps, you will relapse. And if you do work the 12 steps, you won't relapse, because that is inaccurate.
I actually totally agree with you. I have no disrespect for the people that have worked the steps, that have been through it and have gained recovery. I just think when we're oversimplifying the nature of mental health and addiction issues, I don't think there's any way that you can attack this on a macro scale without customizing it to each and every patient as they come through treatment. You just can't give somebody the recipe and it works. You have to attack it in different ways, but you got to get to a keen understanding of what's really going on with that individual. We're going to get into a little bit of this when we talk about some of functional and integrative medicine here in just a minute. As we go through this, I want to just kind of highlight that you went through a course of residential treatment, but that's not all of it. What was your life like after you got out of residential treatment? What was the outpatient experience like? Because we get, when I'm talking to families or having done tours or being with the intake team, there's always that question of, okay, well, what's after? What's next? Just give people a feel for in your mind, like, what was your experience like, but how important is the outpatient level of care and setting the right expectations for how that recovery journey is going to flow is?
Absolutely. I tell families that I work with that residential treatment is the first stop. It's the most imperative stop because it allows individuals to detox, stay sober in a safe environment, get the treatment that they need diagnostically, clinically, and everything else that happens when you get out of rehab is what recovery entails.
That's right.
Recovery truly starts when you leave the doors of rehab. And it is so crucial to have some level of aftercare, whether that's PHP, IOP, individual therapy, psychiatry, all of the above if you can.
Yep.
I know for me, continuing therapy and psychiatry has been a primary focus of my recovery because I need to make sure that I'm mentally well. Because as Gabor Mate says, addiction is not the problem, it's actually the solution. The problem is whatever it is that's going on in terms of mental health, whether it's unresolved trauma, a mental health disorder that's not being treated adequately.
That's right.
And so for me, my recovery is focused on maintaining my mental health because if I'm stable with my mental health, then there's no chance that I'm going to use drugs and alcohol because
Right.
I'm stable, I'm thinking logically, and I have no desire to use. I used drugs and alcohol to cope with untreated mental health disorders.
That is it. I mean, you nailed it. That's what addiction is. So we were talking about with the Bar Association this week is that we've had these artificial demarcations in our healthcare system of addiction and mental health. They're one and the same.
Yes. You cannot talk about addiction as though it exists in a vacuum.
No way.
There's always co-occurring mental health challenges, and that's where people get very confused, whether they're in the treatment space or not. Even professionals, they don't understand that they exist together.
Absolutely. I couldn't agree more. Okay, let's shift gears a little bit. I want to kind of highlight what your life now is like as you've gone through recovery. And you've still in recovery, going through it. You've come back. You're now a practitioner working with individuals. You're at Campbell Recovery Services.
Yes.
Yes. So tell us just a little bit about that and the line of work that you're doing. I want to kind of highlight you're working with a really, really good therapy group. I've had the opportunity. We had dinner a few weeks ago with your team, and based here in Dallas in the Highland Park, University Park area. Very, very good at what you guys do. And I just want to maybe give people a feel for, what's your areas of specialty? What are you focusing on now?
Yeah, after I spent a lot of time working in higher levels of care with more acute individuals, I wanted to really get as much experience under my belt before I went into private practice. And so that's what I did for about 5 years. And now that I'm in private practice at Campbell Recovery Services as a licensed professional counselor and a licensed chemical dependency counselor, I work with adolescents and young adults who are struggling with substance use and high-risk behaviors. And a big part of my role isn't just working with those adolescents and young adults, but also with their family members and how to best support them, because that's a big part of the puzzle. And so I often am making treatment referrals because, as I know personally and professionally, getting the right level of care is imperative.
It's
and
very
so
important.
I'm oftentimes referring people to detox or residential treatment or IOP or PHP because there's only so much that you can manage in an outpatient private practice office when it comes to acute addiction.
That's true. But you're often maybe the first entry point, right?
Yes.
And then probably the continuation of that care once they get out of an acute setting like detox or residential, right?
Absolutely. I love following up with my clients once they've discharged from treatment. Sometimes they're living at sober living or doing an aftercare program like IOP or PHP, but I'm their main therapist through that process. And it's an incredibly gratifying position to be able to be on this side of the desk or side of the couch, so to speak. Because I was for so much of my life, I was the client and I was the one struggling. And to be able to be in a position where I am the trusted adult is, I don't even have words for how much that means to me, especially to be trusted by Highland Park families who, when I was growing up, I was not trusted by.
Right.
And to be able to give therapeutic feedback and suggestions, treatment recommendations that can be life-saving and at the very least life-changing, that's a huge part of my own recovery. And what keeps me sober is that I have the privilege and honor of being able to walk with people through their recovery journey. And a big part of my philosophy is destigmatizing addiction. And that doesn't mean that we should promote drug use, but we need to treat people with dignity and respect because addiction is not a choice. It is a coping skill, a coping mechanism for something else that's going on. And I'm very passionate about trying to figure out what that is for my clients, whether that's unresolved trauma, personality disorder, a mood disorder, whatever that may be, and put all the pieces of the puzzle together to create that formula so that they can live a life that's worth living.
Yeah, no, I love that. And I like the fact that you work with the the youth and the presumably the adolescents, young adults. And I've always had a heart for that area of the population or that segment of the population because I feel like, looking back on my life, you're having troubles when you're in your early teenage years, adolescent years. They can be absolute blips on the radar screen when you're in your 40s, 50s. Looking back, it can make your life in a positive way. And you can avoid a lot of real hard consequences if you address some of these issues early. So I'm curious with you, when you're working with some of these young adults or adolescents, do you feel like you're able to kind of capture them at a point where you can say, look, if we can remediate this now, you won't have a lot of these downstream issues as an adult where you're going to be in treatment or maybe have a lot of the hard consequences that sometimes come with addiction as an adult?
Absolutely. That can be a huge motivating factor for them is if we flash forward and talk about, well, if we keep going down this path of drug use or alcohol use and high-risk behaviors, do you want to eventually have to drop out of college or get arrested or get cut off by your family, or even worse, have this continue for 10, 15, 20 years, lose your family, have to get divorced, not be able to see your kids. And that can oftentimes be the shift in perspective and thinking for these young people, because as we know, adolescents and young adults have a limited ability to see into the future. Part of that is because those areas of their brain just aren't quite developed fully yet. And also they just feel as though they can do whatever they want without the consequences. And that's also part of that lack of frontal lobe development. So talking about what those consequences could potentially look like if they continue down that road can absolutely help them realize that they are going down the wrong path and that they're at this fork in the road where they can keep going down that road and see what happens, or they can really shift their behaviors and live a life beyond their wildest imagination.
Absolutely. You know, you're working down, being from Dallas, grew up in the Richardson area. I'm familiar with all the areas of the Metroplex. You're working in an area that is known as high performing. A lot of, Highland Park High School, great athletic programs. It's a lot of hard-charging families, a lot of pressure, I would imagine. Can you kind of give us a feel for what you're seeing as the main issues, like kind of generalizing? What are the main issues you're seeing with the young kids today and the families? What are some things that just keep kind of become a recurring theme that you feel like if we don't get on top of these issues, we're going to continue to perpetuate the problems with the youth? What is it that you're really seeing that's stressing out and creating a lot of the issues with the youth today?
Something that I'm consistently shocked by as a Highland Park graduate almost 15 years ago, and now working with predominantly Highland Park students, is that not much has changed. And these cultures and norms continue to exist. And a lot of them are very toxic. And so in addition to a very high pressure environment where the standards are just insurmountable for teenagers, there is a normalization of binge drinking within households, not only with the kids, but with the parents. Nowadays, kids are getting fake IDs purchased by their parents. They're getting alcohol purchased by their parents. There is a total normalization of these kids binge drinking and even smoking marijuana. And there's a lack of education with the parents that the marijuana that they grew up smoking is completely different than the marijuana that their kids are smoking. So a big part of my job that I'm passionate about is giving educational seminars and even just one-on-one education with my clients' parents that smoking marijuana is, number one, a felony in Texas if it is a dab pen, which is what they're using. It's illegal, and it's incredibly harmful for these adolescents and young people. And so I would say those are the two biggest themes in terms of substance use. But I also see that individuals in that area of town are very reluctant and fearful of reaching out for help because there are such expectations of perfection, of we have to have this white picket fence life where we send out the Christmas cards and all look perfect. But the reality is you could drive down any street in Highland Park and point out houses where addiction exists. Because statistically, 1 in 10 American adults struggles with addiction, and 9 out of 10 individuals that struggle with addiction do not receive any form of treatment. And so people are very treatment resistant. And one major selling point for clients to come and see me is that I grew up in Highland Park. Because I understand firsthand the culture, and I also believe that they are potentially untrusting of people who don't come from Highland Park, just because there is a very unique subculture that exists within Highland Park.
Yeah, I totally agree. And it's actually what I picked up on and just learning more about you and your practices. You have a real interesting niche, because I think that subculture is very unique. And having grown up in it, you have a deep appreciation for what those contributing factors are and how to help those young kids. But I just feel like, when you take a few steps back, helping these families with their own family unit is really, really important. And, our society just feels, in general, I'm generalizing here, is that it just feels like there's an enormous amount of stress. It's hard to turn things off. You're bombarded with constant news. You've got cell phones in everybody's pockets. You're starting to see schools pull back on that and put the phones away throughout the school day, which I'm a huge, huge fan of that. But just, when I grew up in a time, we didn't have cell phones. If you needed to call somebody, you called a landline. It was actually connected to a wall, and if your parents wanted to listen to your call, they could, but you could hear them pick it up. But you could detach. There was like, you went to school, you had your day, you came home, you were really with your family, and you're off. Now, everything follows you around. And so you're, indoctrinated with social media, you're in everybody's life. There's a lot of pressures. You got a lot of dual working families that are just constantly at the market chasing things, and the kids. In those environments, I just think there's an enormous amount of stress on young minds and expectations that they're just not mature enough to handle a lot of it. And they'll seek out substances in a variety of ways to kind of alleviate those feelings.
We are seeing such a rise in substance use, particularly marijuana use among youth. And we're seeing a rise in even gambling among youth, porn. I mean, anything that can be accessed through the internet, we're seeing a rise in. And consequently, we are seeing a rise in mental health challenges. And I can only imagine having that experience as a teenager with the access to information. What I hear commonly is that the teens I work with know exactly where their friends are at all times because they have their locations on Snapchat. So they know exactly when they're being left out. They know what everyone's doing at all times. So if they do choose to stay in to take care of themselves because they recognize, I'm stressed, I have a lot of exams next week, I need to just rest and study, then they're seeing pictures in real time of what they're missing.
That's right.
And so it's very difficult for teenagers, especially, and young adults to find a balance in their social life and personal life because there's always something going on and they're always going to know about it. Whereas previously there might have been parties or events going on, but we didn't see that footage in real time.
That's right. Yeah, maybe it swings back the other way in due time, This generation growing up with all of it, they recognize that the limitations of having all that access, maybe with their next generation and their kids, they kind of push the pendulum back the other way.
Let's go back to flip phones.
I'd be open for it.
My dad had a flip phone up until several years ago. It was his kind of running bit. But, I mean, I think that worked well for his mental health.
I bet it did.
Yeah.
I might take his advice and go with that.
Right.
Okay, well, let's jump into something that you and I have spoken about, at some of our dinners and just over time. That it's an area that, in Enterhealth, we're pretty passionate about, which is looking at, say, the underlying emotional co-occurring issue, looking at that as at a deeper level. Okay, the gold standard in our space has always been medications plus therapy equals best outcomes. One of the issues that I feel very strongly about is that there's something going on beneath the symptoms. Okay, and from a psychiatric standpoint, you were talking about being with us and the physician having enough time to really understand what was going on with you. That is the exception to the rule. Psychiatry today is a 15-minute med check. We're driving through. We're making sure you're okay in detox. We're perfunctory, really looking at what's going on with your mental health issues, seeing if you have any, issues with the medications you're on, maybe changing them. But we're moving quick, and we're off to the next 3 or 4 or 5 gigs. That is the reality of it. It's kind of a sad reality. And I think there's a growing body out there, and this happened, I feel like, post-COVID when I started to meet with a lot of the concierge doctors, that were going deeper with their patients. I was able to see that a lot of people were getting great care frankly, with independent concierge doctors, say outside of a big healthcare system. They were able to really utilize their ingenuity, their medical skills. They didn't have 500 to 1,000 patients to see. They had a manageable load. They could spend time with you. If they needed to use the critical thinking skills, they could use them, which is often what I feel like doctors go into the practice to do, is to learn critical thinking and apply that to a patient to really understand what's going on and how can I help them. And I feel like in psychiatry, mental health, I feel like it applies right to the addiction field because it's involved in mental health, is this opportunity to bring more of the integrative, functional, there's different labels, but that type of thinking to the table. Because typically in psychiatry, you don't do any diagnostics from a laboratory standpoint. We're not looking at anything. I'm sitting there talking to you. I'm using my experience. I'm putting you into these artificial DSM boxes, and then I'm going to pull out the medications that fit, and we're going to try them. And then I'm going to abdicate maybe the most important part of the whole experience, which is therapy, to therapists. Even though doctors could blend themselves into that role a little bit if they wanted. So as I've watched this kind of unfold kind of post-COVID and different families that I know that I've grown up with my kids' schools, they're all kind of finding themselves to what I call like quarterbacks, these integrative doctors that are looking at things more holistically, looking at things deeper. They're uncovering real issues that maybe had never been addressed, getting people off of a litany of medications that they've been stuck on, and helping them live more sustainable, healthier lives. And so take that whole thinking. Can we apply that in your mind to mental health, addiction? And if so, why haven't we been doing this?
It's such a good question because the brain and body are obviously interconnected and work very closely together. That is a complete no-brainer.
Right.
Yet, for some reason, historically, we've treated them completely separately.
That's right.
And there are a multitude of physical health ailments that could be occurring that are exacerbating mental health symptoms or even causing them. And so through running different laboratory testing to see, oh, your thyroid is not functioning in the way that it is, and that's exacerbating your depression or anxiety symptoms. Or, oh, you are lacking on multiple key vitamins that help with energy and mood and attention span. You know, when we can really understand what's going on internally, then we can treat the symptoms properly because
Totally agree.
As you mentioned, psychiatry is based on self-report measures.
That's right.
And while that is a critical component, we also need objective data to go off of because self-report measures are only as accurate as the person who is reporting them can report, you know? And so having objective data to see what is going on internally, I think is a complete game changer. And if all of my clients could go and get comprehensive functional lab work done, I think we'd be able to have such a more comprehensive and detailed treatment plan because then we could know, oh, if we're able to boost some of these vitamins or treat something that might be going on that we had no idea about, like an autoimmune disorder, then we can start to see progress.
100%. You had any experience with a functional doctor?
Yes, I currently work with a functional medicine practitioner named Everest Goldstein.
Oh, yeah. Know her very well. She's wonderful.
Yes, she is fantastic. And it's just been so wonderful to know what's going on in my own body because there might be certain areas that I'm trying to improve on, but I feel like the medications I'm on aren't helping or I can't really tell if the meds are helping. And so getting that comprehensive lab work done and analyzed by someone who really can give me clear explanations as to what all of these numbers mean is so important because as you mentioned, a lot of times healthcare nowadays is quantity over quality based on insurance. It just has to be that way,
right.
where we're ripping and rolling through the patients
That's
as
right.
quickly as possible, almost like waiters at a busy restaurant. They're trying to turn the tables as fast as they can.
That's right.
And so what's really cool about functional medicine providers like Everest is they can really sit down next to you and go line by line on your lab results. And rather than just saying, yep, everything's in range, or, oh, this wasn't in range, but doesn't matter, which is what doctors commonly do.
right.
They can go line by line and talk to you about what is going on in your body and give really great suggestions as to how you can augment your diet or add supplements to your diet to help manage whatever it is that's going on.
I completely agree. and I feel like the area we're trying to apply it to is because it's functional medicine is blown up. I mean, relatively speaking, it's blown up. A lot of people are seeking out those types of practitioners. We're trying to apply it right here with our patient population that we know suffers from underlying emotional issues, and drawing those, kind of connecting those dots to what biomarkers are you looking at and why, and then being able to sit down with a patient and say, look, this is the set of labs we've done. Let me explain to you why we did them. Let me explain to you the results of each and why, if we don't remediate certain ones, this is going to have a direct impact on your emotional health. Or, even the other way, if we don't remediate these, which I found super interesting this past year, then the medications that we do prescribe actually won't work as effectively.
Absolutely, because they're not going to be metabolized as well. Right.
So I've felt like in this world, we tend to put things in boxes, but it's really, we need to remove the barriers because Western medicine has a lot to offer. And I think if you have a real acute issue, you need to come to America. We will take care of you. You have a major issue. When it comes to the softer sciences, if you will, of like psychiatry, where you're not really looking at objective types of data points, it's a fair amount of judgment calls, and you don't really have the time to critically think. That's a real area of opportunity to bring in more of this type of thinking and apply it. Because I feel like in the end, what you're doing is you're giving the patient, you're really informing them on things they've never understood about themselves. We're going through this process right now. We've been at it since, I guess, mid-March of this year, and we just had a meeting on it yesterday, and it's fascinating. I mean, it's like we're opening up a whole new frontier of things that we're looking at that can apply directly to a patient's mental health. And that if they will follow the regimen, I feel like the recovery opportunity is going to be so much more sustainable downstream.
Absolutely. One thing that Mr. Bob had us focus on at Enterhealth when I was in treatment was the wellness wheel, which breaks down our overall health into 8 key areas, like mental health, physical health, social well-being, occupational health, financial health. And the message there was we have to have balance in all 8 of those areas in order to truly be healthy and to achieve overall wellness. And I think that goes hand in hand with functional medicine, is looking at people holistically,
100%.
connecting the brain and the body, and doing whatever we can to unravel the layers to get to that root cause.
That's right. We need the time. And the reimbursement, to attack this on a macro level, you're going to have the reimbursement system set up in such a way where it allows the great minds to do the work. Right. And until we unlock that, I don't know that we're going to be able to make a huge impact. But, in the interim, we're going to try to do our darndest to try to bring this to the market.
Yeah.
Okay. This has been fun to talk with you. I want to kind of close with what's on your horizon? What are the things that you're kind of looking at in your career? Are there areas you want to grow into? There are kind of areas of opportunity that you want to try to pursue? I'm just trying to see what are you looking at kind of downstream through your eyes as a practitioner?
Well, I always want to stay up to date on the research with addiction medicine and addiction treatment and new ways that we can handle substance abuse and addictive behaviors and mental health disorders. Yep. And so I like to keep my finger on the pulse there. But I'm also really interested and passionate about public speaking. next week I have the opportunity to go to my alma mater, Highland Park Middle School, and speak to 2,000 middle schoolers for Red Ribbon Week and drug prevention. And it's so full circle. And so I want to be able to continue branching out into the community in different aspects, and especially with public speaking, to educate people on such a taboo topic that they're afraid to bring up and don't know much about, so that people can make more informed decisions, especially when it pertains to kids and teenagers, where they find something in their room, they know what that is, and they know how to address that appropriately.
I love it. I love it. Well, I have to tell you, this has been an absolute pleasure to have you on. I want to thank you for your candor and your willingness to come on, tell your story. And I think it's great to do this because a lot of the people that could be listening are going to be seeing, they may have a situation in their life where they can kind of see somebody that's gone through this and be on the other side and having success in their life. So I appreciate you being willing to share your story, and I think you should be really proud of yourself on the work that you're doing today. So thank you for being with me.
Yeah, well, thank you so much. None of this would be possible without Enterhealth, and it has truly changed my life and given me a life. And I could never have predicted the life that I have today. And it is so beautiful, mesmerizingly beautiful to be able to have the life that I do today. So thank you for the work that you're doing.
You're very welcome. Thank you.